Hi everyone, this is Dr. Ginger here. I wanted to take a moment of your time to talk about medical gaslighting. Specifically medical gaslighting as it applies to pelvic health. Because, and now when I say pelvic health, I mean voice to pelvic floor, not just the pelvic floor. Because a lot of what you do in the pelvic floor depends on your voice. Think about it from a trauma perspective, for example. Can you sing if you're scared, right? Can you speak if you're scared? Can you digest food well, right? If you're nervous. If you've experienced trauma, especially inside the system, a system that's supposed to be a safe sanctuary, the healthcare system, the system where you're supposed to be able to get help. If you go there for help and they're telling you it's in your head, when it relates to pelvic health, I want you to recognize a couple of things. One, it's probably not in your head. If you've got good body awareness, you know when something's not right. You can feel it. I want you to trust that. Don't let anybody make you second guess yourself. Second, if you're going into the healthcare system and you're a mom postpartum, you 100% need pelvic PT or OT. 100%. Always. And anyone that says any different is wrong. Because you just gave birth, that's a marathon event, no matter how you gave birth. C-section, vaginal, doesn't matter. That's a marathon event. And a lot of things happen with 100% incidence, like diastasis rectus abdominis, abdominal split. More than 86, I think, % of women tear during birth. That is absolutely an indication. If you're tearing or you've been cut in any way, or even just being pregnant and giving birth, you are going to have pathologies that are a natural occurrence of giving birth, that are injuries that require pelvic health. So if you're being told you don't need it, that's medical gaslighting. You absolutely do need it, and you have a right to it. First. Second, if you're going in and you have pelvic health issues where it's hard to pee, it's hard to poop, right? You can't get that out. It feels like something's tight, then it probably is. If you have hip pain, back pain, and no one has checked your pelvic floor, then it's incomplete. Your healthcare is incomplete. So if you're struggling with those issues and someone is saying, we don't know what else to do for you, pelvic health helps. So let me go over those issues again, right? We know obvious things like leakage, but it's way, way beyond leakage. It's pelvic organs dropping. It's called prolapse. It's abdominal splitting. It's back pain. It is hip pain. It is rib cage and breathing pain. And one more thing. If you've been to pelvic PTs or OTs, if you've been to a pelvic health practitioner and they say, we've done all that we can, I don't know what else to do, and they haven't checked your voice, then you didn't get complete care. Because pelvic health depends on treating the voice too. You have to. You can't get away with not treating the voice. So that's why I use something called a voice to pelvic floor approach. I call it a 3 diaphragm approach. The 3 diaphragms have been mentioned in the literature before. It's out there. Look it up. There have even been 5 diaphragms mentioned. But in terms of what I focus on as a pelvic PT and an ortho PT, because I was born as an ortho PT and then I became a pelvic PT later, it is all dependent on not just the mechanical connection of the voice to the pelvic floor. There's a neural connection via the vagus nerve. And when you have a pelvic health issue, it can also overlap with a sense of feeling safe in situations. Maybe you've experienced trauma, and a lot of people have experienced trauma because sometimes it's hard to get the help you need when you have pelvic pain, because there's not enough of us out there specializing to figure out those kind of complex, difficult cases. So if you're having those issues, vocal issues, breathing issues, narrow airway issues, hernia issues, hip pain, post-hip arthroscopy, even hip replacement, back pain, pubic symphysis pain, SI joint pain, TMJD, jaw pain. When I mean voice issues, I mean performing arts, public speaking. It comes down to treating both ends of the spectrum, okay? Not just the pelvic floor alone. It doesn't exist in a vacuum. So if you're struggling with voice issues, pelvic practitioners should be evaluating it and be able to help. Your ENT is super helpful, but it's not the end all be all. It's part of the team, right? And your voice coach, part of the team. Any respiratory issues, even allergies, not just narrow airway. If someone says, oh, you have a narrow airway, here's some steroids. Wait a second, did they evaluate the orofacial area? Or are they just telling you, here, take a drug for your airway, but they've not really looked for root cause? It could be orofacial tightness. You just don't know unless it's evaluated. And then if you've got any pelvic health issues, okay, all 3 diaphragms must be addressed. And if they're not, your care is incomplete. And then you risk being medically gaslit. And that's not okay. That's never okay. So if you feel like something's off with your care and you're not getting the answers you need, you're probably right. Okay, so that was it. That's my soapbox that I wanted to get up on. If you are struggling to find someone to listen to you, please reach out. Go to garnerpelvichealth.com. We have people that answer the phones 24 hours a day, 7 days a week. They will direct you in the right way. We have pelvic health inventories. APTA's Academy of Pelvic Health has one. There's an organization called GFAM, which has a pelvic health locator, PT and OT locator. We will help point you in the right direction to find those resources that you need. I can only do a certain amount of consults, and I do free consults, but I can only do a limited number of those. That's why I train other PTs to do voice to pelvic floor therapy, as well as OTs too. But I will do my best to help you out. So go to garnerpelvichealth.com. If you want to learn about the 3 diaphragms, I have a YouTube channel you can subscribe to. It's Dr. Ginger Garner, and I have a 3 diaphragm playlist, voice to pelvic floor 3 diaphragm playlist. And I'm always adding things to that playlist, but I also have a podcast you can listen to. It's called the Living Well Podcast, and I talk about medical gaslighting. The particular season I'm on now, this will probably be a perpetuating theme, is ending medical gaslighting and making healthcare safe. This season is about safety for women in healthcare, but there are lots of other people who need that safety in healthcare too, so that we can end gaslighting, medical gaslighting for good. Thanks, guys. I'd love to hear your comments and your feedback, and until next time, stay well.